we have to go under the assumption that our bodies were designed the way they were designed, and it was designed perfectly. So is prostate cancer something that happened because we just had bad luck or genes, or is it a result of the way we lived our lives? And so how do we know one way or the other? So I describe myself as a yoga-based integrative cardiovascular specialist, which sounds like a lot of mumbo jumbo, but why would anybody describe themselves that way at all? And it's because there's a Dr. Dean Ornish who proved that you could reverse heart disease in 1990. He did a study called the Lifestyle Heart Trial. And what he did is he took people with heart disease and he put them on a diet, and he exercised, stress reduction, and he did a catheterization the first day and 1 year later. And then he did another group of people that had heart disease, and they just did the usual care plan like everybody else. At the end of that year, they looked at the catheterizations, they compared the two groups, and the people in the yoga group, the people that did lifestyle modification, they actually had a reduction in their chest pain. They had a reduction in the narrowings in the arteries. So they actually measured something functional, the way that was affecting their lives, but they also measured something anatomic, which actually shrunk that. And so the idea is that our bodies actually have the ability to reverse a chronic disease. It's a chronic disease process that happens many, many years before you even know it's there. It's brewing underneath. So why does it happen? It's because of what we do. And it's interesting because Dean Ornish also did a program on reversing heart disease using the same program, and it worked. So what we understand is that it is about the way we live our lives. So one of the things that Nicole came up that was really important is to add 2 servings of vegetables to every meal. Think about that. 5 to 10 servings a day is how many vegetables you're going to eat. We all know there's tremendous cancer prevention and reversal properties in that. If you did that with every single meal, that would be 6 servings. Is that so hard to do? And that would be like one thing that you could do for sure.
Yeah, piggybacking off of that, one thing, like both of us are plant-based, and I would say vegan can be like a swear word to some people. So we know eating more plants is good, especially with prostate. And when we first started meeting with people that were going to work with us, they were afraid they were going to have to go vegan. So that's why I said, like, no, maybe 10% of people that we work with even have the desire of doing that. And you can still do so much good, just add in 2 servings of vegetables. So we start there, and then that's less of a daunting thing. And then maybe one day you want to take it to the next level, and maybe one day, because that becomes your new normal, 2 servings of vegetable every meal. That's easy after a while. And then what do you want to do next?